Good day to everyone. I hope you're having a great day. I am Chris Robert Melia, and today I have been assigned by our nursing director to lead an in-service training program for the newly recruited nurses who will be working in the operating theater unit. Also, I serve as one of the team leaders in the department, and I would like to extend a warm welcome to everyone at our facility. Let us begin our session with a brief overview of the unit. As an intraoperative nurse, you will be working in the operating theater department, which includes three theaters. These theaters accommodate a variety of surgical procedures, and you will be assigned in different areas. Some of the specialties include, to name a few, orthopedic surgery, general surgery, bariatric surgery, ENT, which is ear, nose, and throat surgery, spine surgery, and among others. As an operating theater nurses, we possess a high level of skills and expertise in handling a wide range of procedures. We manage daily tasks, different responsibilities within our department. In this meeting, we will concentrate on the one most crucial skill that an OT nurse must master, and that is surgical hand scrub. By the end of this teaching demonstration skill session, the participants, you will be able to first, state the significance of surgical hand scrub in infection control. Second, compare surgical hand scrub with regular hand washing and their key differences. Third, execute the steps involved in surgical hand scrub. Fourth, demonstrate the surgical hand scrub technique correctly. And lastly, evaluate the quality of surgical hand scrub through a return demonstration. As a scrub nurse, you play a critical role in the operating theater, assisting surgical team and ensuring procedures safely and aseptically. There are key areas you should be knowledgeable about. First, surgical procedures. Understanding the various surgical procedures thoroughly, including specific steps and instruments required for each cases, are vital. Second is instrumentation. Be familiar with all surgical instruments, their functions, their names. This includes the ability to quickly and efficiently pass instruments to the surgeon. Then lastly, the most important part which we'll be focusing on is the mastery in the principles and practices of maintaining a sterile field to prevent infection is proper surgical hand scrub technique. Can any one of you share in your own words the difference between surgical hand scrub and regular hand washing? Yes. Excellent. Yes. Correct. Yes. Thank you all for sharing your ideas with regards to surgical hand scrub and regular hand washing. According to WHO, surgical hand scrub is a critical practice aimed at reducing the risk of transmitting infection in healthcare settings, particularly in surgical environments. It involves a thorough cleansing of hands and forearms using antiseptic agent to remove or destroy transient microorganisms, followed by wearing surgical gown and sterile gloves. While on the other hand, regular hand washing is a key practice for maintaining hygiene and preventing the spread of infectious diseases. As we go further on this session, we will be able to know their differences and importance. As an intraoperative nurses, surgical hand scrub is a critical component in infection control in healthcare settings. It is essential practice, especially before performing any surgical procedures. Let me discuss to you all its significance. First, removal of transient flora. Surgical hand scrub is designed to remove transient microorganisms that the skin can pick up from their environment or through contact with the patients. These organisms can be source of infection if they enter the surgical site. Second is reduction of resident flora. Even though resident microorganisms are typically harmless, a high concentration can lead to infections if they enter the sterile body sites. Surgical hand scrub significantly reduces the number of microorganisms. Third is prevention of surgical site infections. Surgical site infections can occur when pathogens are introduced into the surgical wounds. Proper surgical hand scrub is one of the most effective measures to prevent SSI. And lastly, enhancement of the sterile field. Maintaining a sterile environment is vital during surgeries. Surgical hand scrub help and ensures that the surgical team does not introduce a contaminants to the sterile field. On the other hand, regular hand washing is a practice of cleaning hands with soap and water to remove dirt, germs, and other contaminants. It is a fundamental aspect of personal hygiene and public health recommended for everyone. Importance of regular hand washing. First, prevention of disease transmission. Regular hand washing is one of the most effective ways to prevent spread of infectious diseases, including flu and other more severe infections. Second is reduction of germs and bacteria. It helps remove bacteria, viruses, and other harmful microorganisms from the hands that could cause illnesses. Third, promotion of public health. By preventing the spread of pathogens, hand washing contributes to the overall health of the community and reduces the burden of healthcare system. And lastly, environmental health encourages sanitation and hygiene practices that protect and improve the health of the environment and the water system. So in summary, surgical hand scrub is more rigorous and antiseptic focused procedure designed for sterility in surgical environment, whereas regular hand washing is a simple but yet powerful tool in combating the spread of infection in our daily lives. Now that we all know the difference between surgical hand scrub and regular hand washing, we are now on the phase of our discussion to demonstrate to you all the proper surgical hand scrub technique. In this demonstration, we will do an anatomical surgical hand scrub procedure with brush stroke method. Mastering this technique is vital for maintaining sterility in surgical settings and preventing infections. This procedure will take about 3 to 5 minutes to complete. Before beginning the surgical hand scrub procedure, you must remove all jewelry from both hands and arms. Inspect your skin and nails and ensure skin is free from any cuts and wounds. Nails must not extend past your fingertips without chips or cracks. The second step is put on your personal protective equipment or PPE. Make sure your hair and ears are tucked into your surgical head cover. Don proper eye protection and surgical mask covering your nose, mouth. To begin scrub, open a sponge of your preferred hospital-approved antiseptic, either chlorhexidine or betadine sponge. For this demonstration, I will use the option of chlorhexidine sponge. You must pre-wash your hands and arms only if this is the first case of the day, or if your hands are visibly soiled. Use the soap from the dispenser located within the scrub sink. Then use a disposable nail pick and clean under your fingernails under running water. Dispose of the nail pick in the trash can beside the scrub sink. Then rinse hands, forearms, once hands and arms has been washed. Remove the sterile surgical sponge from its wrapper and moisten the sponge under the running water by squeezing and releasing it. With fingertips together, use light but firm pressure to stroke the nails back and forth motion with the abrasive brush side of the sponge approximately 30 times. The abrasive brush side is only used on your fingertips. The non-abrasive side should be used for the remainder of the scrub. Next, turn the surgical sponge over to the non-abrasive side. Place fingers side by side, including the thumb, and scrub at the surface of the palm for 10 strokes. Then turn the hand over and scrub the dorsal surface for 10 strokes as well. The next step in this demonstration skill is to scrub the outside surface of the thumb from wrist to the tip of the thumb for 10 strokes. Then continue to apply 10 strokes to the other side of the thumb and each side of your fingers. Now that you scrub your hand, it's time to scrub your arm on the same side. Mentally divide the forearm into thirds from wrist up to 2 inches above the elbow. When scrubbing each third of your forearm, apply 10 strokes to the top, bottom, and both sides of each section. Once you scrub one area, do not go back. Next is repeat the scrub on the other hand and arm. Once both hands and arms are complete, discard the surgical sponge in the trash can beside the scrub sink. Start rinsing at your fingertips and continue to the hand, forearm, and elbow, moving in one forward direction to the water. Always keep your elbow at the right angle and your hand raised above the level of your elbow. Do not move your arms back and forth into the water. If you need additional rinsing, completely remove your arm from the water stream and re-enter the fingertips until you reach the elbow. Once rinsing is complete and no antiseptic remains on the hands and arms, keep the hands above the level of the elbow and away from the scrub attire and non-sterile surfaces. Allow residual water to drip off the elbows and into the sink. Now you are ready to enter the theater, and you can dry your hands and arms with a sterile towel before donning a sterile surgical gown and surgical gloves. Remember, surgical hand scrub is critical practice. The aim is to strengthen the nurses' commitment to maintaining high standards of infection control and patient safety in operating theater. The main objective of this skill is to enhance their understanding and implementation of effective hand antiseptic practices, which is crucial in minimizing the risk of surgical site infections. This will be best achieved by best practices, skill enhancement, hands-on practice, compliance, and consistency by establishing surgical scrub protocols and procedures to standardize practice across all surgical teams. Having said that, if you have any questions or concerns, you can raise them now. Okay, if there is none, I will give you ample time before we start the return demonstration. Bear in mind, once you are called to perform a surgical hand scrub skill, make sure you know the importance behind doing so and the step-by-step of the procedure. Again, thank you so much for listening and sharing your thoughts about this session.